Hello everyone, welcome again to this new topic, a very important topic, that is the coronary artery. There is anatomy of the coronary artery. Myself Dr Ankit Khandelwal, MBBS MS anatomy educator in our Unacademy platform. Let's start the topic, coronary artery, anatomy of it. So before that, let us see some features of the Plus subscription, and these are the iconic, which includes Unacademy and prep ladder. These are the NEET PG Combat. I hope many of you may have given the 10th of October, the other ones are coming. And this is a raise hand feature by which in the live classes, both plus and special, if something you are trying to explain and you are not able to explain it by typing, you can even talk to the faculty live right there in the live classes. Exam day, so yeah, free grand tests on 17th October for the INI-CET, and these are all the special class features. So special class, my special class are happening daily at 10 a.m. around an hour, 45 minutes to 1 hour. So all the important topics we try to discuss on the day of the discussion, and the next day we discuss some of the important MCQs regarding that topic. So daily at 10 a.m. Around 6 days a week it is, Monday to Saturday. So you can opt for that, you can see over that. Now these are what? These are all the QBanks. You can see all the various questions with the detailed explanations and the latest exam pattern. And congratulations to all the toppers, and all the best for the ones who will be topping the next year. Okay. These are all the new batches just recently been started just around 4-5 days back for the FMG, INI-CET, NEET and the clinical batches. You can have a look at about them. This is for the NEET PG subscription. There are two options, iconic, which includes Unacademy prep ladder. This is simply plus, which will only include the Unacademy, and you can subscribe to any one of them. Also remember, if you want some extra discount, you can use this code, Dr Ankit YT. If you want some extra discount, you can use this code. That is an optional. You can use it, right? Let's come to the topic. The topic of our discussion is what? Coronary artery. And coronary artery is needless to say how important the topic is. We all know the importance of it. So initially, a few brief outlines about the basics of the coronary artery. Coronary arteries are the arteries which supply the heart. So it is like a vasa vasorum, like the vessel supplying the vessel. So heart is what is pumping organ supplying the blood. It is just like a huge dilated vessel. So vessel supplying the vessel is coronary artery. It is like a vasa vasorum. Normally, and there are exceptions, but normally there are two coronary arteries, which are the right and the left. And where are they arising from? They are arising from the aortic sinuses. From the aortic. What is the aortic sinus? It is a dilated space in the ascending aorta. You have three aortic sinuses. Out of them, normally the two, that is the anterior and the left posterior one, that will give rise to the two coronary arteries, which are the right and the left coronary artery. So normally there are two coronary arteries, right and left. Right one comes from the anterior aortic sinus, left one comes from the left posterior aortic sinus. Where are the sinuses present? In the ascending aorta. Which is a bigger coronary artery? The left coronary artery supplies more of the heart volume than the left coronary artery, point number one. Okay, which is a longer artery? Then you may say, okay, RC is slightly longer, the main trunk is slightly longer, but LC supplies more of the area, that we'll see, than the RCA. Basic idea, these are the coronary arteries. Then, where would you see the coronary arteries? If you are shown a heart, where would you try to identify the trunk of the coronary artery? Where would you? For that, you have to understand the basic anatomy of the heart. That where are the four chambers? If you know this, where are the four chambers of the heart, then it is very simple to look for the coronary arteries. Why? Because coronary arteries, they run in the coronary groove. Sir, what is coronary groove? Which has the coronary artery? Where is coronary artery? In the coronary groove. So where it is? Coronary groove is also known as atrioventricular groove. So it is other name of atrioventricular groove. So now got the point. If you know the position of the atria or the ventricle, the groove between them, you will find the coronary arteries, the main trunk. I am not saying the branches, the main trunk. So the main point is the main trunk lies in this groove. The main trunk of the coronary artery will lie where? In this coronary or the atrioventricular groove. So now basic ideas we have come across. The coronary arteries are normally two. They come from the aortic sinus. They run in the coronary groove, that is between the atria and the ventricle. The LCA supplies more volume than the RCA. LCA is to the left side, RCA is to the right side. Now we are eligible to look for the images showing you the vessels. This is the anterior view of the heart. Anterior view of the heart, you must be knowing the most anterior chamber is right ventricle. So the majority of the sternocostal surface is found by the right ventricle. The right border is mainly by the RA, left border is mainly by the LV, left ventricle, right atrium. If this is RV, this is the pulmonary trunk, obviously. LV gives rise to the aorta, which crosses behind it. So this is the aorta over here. That is the aorta over here. So where would be the ascending aorta? This would be the approximate location of ascending aorta behind the pulmonary trunk. So therefore, it would be giving off the RCA from here and LC from here behind the PT, pulmonary trunk. So you are seeing over here what the right coronary artery. This is what? That is the right coronary artery. I told you, where does it run? Coronary groove. So it is running between the RA, RV. This is the right coronary groove. This is your RCA, right coronary artery. We look for its branches. I'm showing just the beginning, where is the RCA. But sir, we are not seeing the LCA. How will you see it is covered by the PT, pulmonary trunk? Beginning of the LC is covered by the PT in front. But here you will start to see the LC from here. Then it will give off the branches that we will see. Is this the coronary groove? The answer is no, it is not the coronary groove. Why? Coronary groove is between atria ventricle. This is the interventricular groove. So we can't say this is the left coronary artery. It is the main branch of it. That we'll see what are the main branches. So this idea is clear. We are seeing the RCA. Other figures. Let's see the other figures also. Here is the figure. Okay, here's the figure showing you both the RCA and LCA. Anterior view only. This is the ascending aorta over here. Ascending aorta. That is the arch of aorta. This is the pulmonary trunk. That is left pulmonary. This would be the behind. Going behind is the right pulmonary. This is the main chamber in front. That is the RV. That would be the RA over here. This is the LV over here. That is the LV over here. Fine. Trace this purple color RCA. This is the main trunk of RCA. That is your RCA. This is the RCA. Atrioventricular groove. This red color, this over here is the LCA. Main stem of LCA is this. Why is this slightly in paler color? Because it is covered by PT. I told you. This part is the main trunk of LCA. Then it divides into branches. That you are seeing, you know, bright red color. So which is not bright red color, that is posterior. Like bright purple anterior and a pale purple, I hope you can see over it, that are posterior. Bright red anterior, and which are not bright, which are slightly paler, they are posterior. Simple as that. Let us trace each artery and look at these branches. RCA starts from here. That you can see the aortic sinuses over here. These are the aortic sinuses in the ascending aorta. It starts from here between RA, RV, goes over here. Then you can see it is winding around the between the right border and the inferior border. Then it goes posteriorly. Trace this. It goes posteriorly. Again, it will lie behind between RA and RV only. So RCA lies in the right coronary groove. LC lies in the left coronary groove. So posterior also you have a RA and RV. So it is running over there. Then it will reach a point over here. That is known as the crux of the heart. This point is known as, in the pose, you look at the posterior view, that is known as the crux of the heart, where all the interventriculars, interatrials posteriorly, and the coronary groove on the right and the left side, they meet. This area is known as CRUX, crux of the heart. So RCA went from here, then went behind. It will at the crux of the heart. It normally continues as this artery. You can see some paler artery over here. That is between the RA-RV posteriorly. So posterior interventricular artery. This artery is our posterior interventricular, also known as inferior, because that is in the inferior surface. So that is the RCA whole course. Now see what it will supply. It is going to supply RA-RV, obviously, because it is running between them, common sense. It will supply RA-RV both, sending many atrial branches and ventricular branches. But apart from this, we know at the beginning of a RA, or when the SVC enters RA, you have SA node. So it will give the SA nodal artery, very important. It gives the SA nodal artery. Then obviously various atrial ventricular arteries. Then at the beginning also it will give the right conal artery, because that is the conus cordis. If you go with the embryology of the heart, this is outflow is known as the conus cordis, or proximal part of the RV known as conus cordis. So right conus artery comes from here, left conus artery will come from the LCA. But more importantly, the right SA nodal artery. Then it will go supply atrioventricle, curve around. But when it curves around, it gives a very big branch. Can you see over here? Bright purple color running on the inferior margin of the heart, on mainly the RV. That is known as right marginal artery. This one is known as right marginal artery. As the angle is acute compared to the other artery, it is also known as right acute marginal artery. So this one is known as right acute marginal artery running on the inferior border. That is one of the major branches. Then it will go behind. Behind, as it reaches the crux of the heart, it does two things. One, it gives a branch to the AV node, atrioventricular node. Remember the Cox triangle in the intra-atrial septum? When you open up the right atrium, tendon of Todaro, then you have the opening of coronary sinus and the septal valve of the tricuspid valve, that forms a triangle, no? AV node. Here it is located. It will give off the AV nodal artery over here. Then it continues between the RV and the LV, but inferiorly, known as posterior interventricular artery or inferior interventricular artery. And then it ends before the apex. This is the apex of the heart. It will end somewhere over here. So whoever artery gives this branch, posterior interventricular artery, is said to be the dominant artery. So therefore, normally in 70, 80, 85% of cases, the heart is right side dominant. Heart is right dominant. Remember that part. There's also clinical application of this. Don't worry about it. We'll discuss that also sometime later. That is the whole RCA. Now trace the LCA. LCA started from here. Cool. Behind the PT. Not a big deal. It is there. Then it gives off a very important branch running between the RV-LV, known as anterior interventricular artery, also known as left anterior descending artery. This is the anterior interventricular artery. Which one? This one. This one runs between RV-LV, so anterior. Very important for the angina or the stenosis, atherosclerosis, angina pectoris and all. This artery can easily be compressed by the atherosclerosis. So this is the LAD. Now this LAD runs over between the RV, LV, reaches the apex, then it will wind around the apex, and you see this color getting pale. It will reach and it will anastomose with this branch, which is coming from the RCA. This is the anterior interventricular, that was the posterior interventricular. These both, they are running in the interventricular septum. So you can see the thickness of interventricular septum. Okay, anterior-interventricular artery. Now this anterior-interventricular artery gives off various branches. They are known as diagonal branches. All these branches, these ones, they are known as diagonal branches. Only one is shown, there are many. That is the story of LAD. But remember, LCA divides into LAD and it bifurcates into another important artery known as left circumflex artery. This is what we were actually seeing. If you see over this image also, this would be the LAD and that would be the left circumflex. Why we call it left circumflex? Because it is circumflexing around the left border of the heart. So you see over here, this artery, its circumflex around becomes paler in color. This artery, left circumflex, goes around. Where? It is the actual continuation of LCA. Why? Because LCA was in between the atria ventricle. This LCX is also running between left atria and left ventricle. So wherever it is going, this one, above it LA, below it LV. LCX, left circumflex artery. But as RC, when RCA turned around, moved back, it gave off a right acute marginal artery. Same way LCX will give off this artery. That is the left marginal, but it is on the left margin, so left marginal. But is it acute? It has a bigger angle than this one, so it is known as left obtuse marginal artery, written over here. Left obtuse marginal artery. This is the left obtuse marginal artery running on the left margin. Then the LCS will wind around, go posterior, and it will give off supply over there. Okay, it will give supply in the posterior part. This is LCX. But normally it will stop over here before it reaches the left crux, or before it reaches the crux of the heart, because crux mainly is occupied by RCA, not by the LCA or LCX. These are the major branches. So I repeat again, LCA starts, LAD winds around the apex, meets the posterior interventricular, gives off the diagonal branches. The LCA continues as LCX, winds around, gives off the left obtuse marginal, and then goes back. It will supply atria ventricle. There will be a lot of atria ventricular branches. And this LAD will give off branches mainly to right and left bundle also. No, bundle branches after this AV node, with the AV bundle of his, then right and left bundle, mainly by the LAD branches. This is a common route. Let us see more images, and then you will be happy to see more of the images, because more images we see, better. It is which view? Posterior view. Let us continue from there only. If we continue from there, this was our circumflex artery coming from the left border. This area is the crux of the heart. This is the crux of the heart. CRUX, crux of the heart. You can see the right RCA was coming from here. If you want to trace it again, from this point, if we go posteriorly, it is this point. It reaches the crux of the heart, RCA. Then over here it will give off what? It will give off the posterior interventricular artery. These are the posterior interventricular artery. Here it also gave off the artery to the AV node. Let us see if that is leveled over here. That has to be somewhat over here towards the right side. That is the AV nodal branches. Okay, that is the RCA. See, it is giving branches to the RA total over here. What are these? See, this is the ascending aorta. Behind it, pulmonary trunk. That is the SVC. This is the IVC. These are the 4 pulmonary veins. So you know this is the LA. You know this is the RA. And mainly this part is the LV. And this small part would be the RV. So you can see all of them are meeting where? Over at the crux of the heart. This is the crux of the heart. So RCA meeting over here continues as the posterior interventricular. Look at the left circumflex also. This is a left circumflex artery over here. Give off some branches to the LA. Because if LCX will not supply LA, who will supply LA? Give branches. Then obviously the LV branches. Normally does not reach over here. Where? In the crux. So which is the main artery reaching the crux is the RCA. It does not mean RCA supplies. It does not mean RCA supplies the major volume of the heart. No, major area or major volume of the heart is supplied by LC only. Why, sir? Because imagine this is 3 times thicker than RV. So the artery supplying this, it is at least, it is in practical view, it is 3 times the size of this. So this is LV. It is pumping the blood to the whole body. So its thickness, thickness of the wall of LV is 3 times that of RV. So therefore, the LC is a bigger artery. Okay, let us see more images over here. These are some of the casting images on the new techniques that are shown over here. Now what is this? PA is pulmonary trunk, A is aorta. This is the left oblique. I am standing over here taking the picture from here. This is basically what? This is the LC which is coming up from here. LC coming up from here. This is between the RV and the LV. That is the LAD, left anterior descending artery, the double arrow. These are all the diagonal branches. Okay, and then it is continuing as this arrow, that is the left circumflex artery. And this white arrow would be the left obtuse marginal artery. I repeat myself, LCA, LAD, diagonal branches. Then you have LCX, that was LC, this LCX, obtuse marginal, then it will go behind. Okay, next image also we can see over here. This is basically showing you the branches, both right and left coronary artery. So this is the same LAD over here, pulmonary artery, aorta. On the left side, this is the LCA, this is the left coronary artery. But look at the black, that is towards the RCA. Towards the right side, this is the RCA. So this is, imagine the heart is being seated and you are looking at from the upper right side. This is the origin of the RCA. Then if you tilt the heart slightly towards the right, what you will see over here is this. This is the RCA, the main trunk of RCA is this. This is the RCA. You see the RCA. It is giving off what? Which branch is this? This is probably your what? This is your branch coming from the RC to the right ventricle over here. If we just for a second hold on this and we come to this. Okay, so this becomes what? This is your right marginal artery because you have rotated the heart on the right side. This is basically going to the inferior border. That is the apex. This region is the apex. So RCA came from here. It may be looking small, but it is covering up the whole area. It is giving off the, you can say the atria and ventricular branches, then this right marginal artery. Then where it continues behind and when it continues behind, this is the posterior view. Superior on that side, inferior on this side. Apex is on over here. This is the RC which is coming, which is running in the right coronary groove. So this has to be the RA, this has to be the RV. Then it reaches the crux of the heart and you can see from here it is giving out the posterior interventricular artery or the inferior interventricular artery. Just a few images over here for showing the heart. Few of the angiographic images. Look, forget what is written, look at the artery and just try to think which artery it could be. सिर्फ इस image को देखो and then imagine ये कौन सी artery हो सकती है. It is a single artery, major trunk is single only. It should be RCA. What does it mean? It means that look at this artery. Forget the labeling. Labeling का लिखा हो समझ देखो. Artery started gave off 2 major trunks, LAD and circumflex. This has to be LCA. Normally, this is your RCA. Then you can go for conus branches, SA nodal branches, main trunk. This is the ventricular branches. Then around this is the part where it turned around. it is giving off the right marginal artery. This is the right marginal artery. Then this artery went back. It reached where? It reached around the crux over here. Posterior interventricular artery over here. Right coronary artery branches. And if you look at the left coronary artery, in the beginning it divided into LAD, left anterior descending or anterior interventricular artery, and this is the LCX. Anterior interventricular artery giving off diagonal. All these are diagonal. The SP is septal perforator, same as diagonal. They mean the same. They are perforating the interventricular septum. We call them septal perforators. This is anterior interventricular. This will go around the apex, meet with the posterior interventricular, and this is your LCX. It gives off the obtuse marginal artery. This is left atrial branches. Left atrial, LATR is left atrial branches. This is obtuse marginal artery. In the margin, then this is your LCX going around. That is the PIA. What is PIA? Posterior interventricular. That came up from the crux of the crux of the heart. Now at times, this is 10 to 15%. This is right over here. LCX may give posterior interventricular artery. Around 10 to 15%, the heart is left dominant. Not a big deal. Then LCX reaches the crux, it gives out the post. So in this case, what is the problem? Is that the LCX and the anterior, they both will anastomose. So if there is a blockage over here, the whole septum is gone. That is the drawback of being a left dominant heart. When there was a right dominant heart, then at least this artery was coming from the right coronary artery. That is the problem. If the LCA gets blocked, then whole interventricular septum is gone. That is a big issue. Okay, now a few images over here. What are these images? This is the thing which we saw, no, that left dominant heart. Can you see the LCA over here? I hope you can very well see. You can also see the LAD over here. Yes, you can see the LCX over here, winds around. That is the left obtuse marginal. Can you see the LCX giving off the posterior? That is left dominant. This is obviously purple is RCA, not giving off the post. That is the left dominant. Okay, and the feature over here, no, SA nodal artery coming. So that is anomaly, not anomaly, but a simple anatomical variation, which you can say. One over here. What is anomaly? LCA is fine, RCA is fine. RCA giving off the posterior interventricular, you can see fine. What is the anomaly? SA nodal artery over here, as labeled over here, is coming from the LCA. So in this case, RCA did not give SA nodal artery. That can happen, not a big deal. So during the development and embryology process, minor changes are very common. They are not very, very common. LCA giving off the SA nodal artery. That is a minor change over here. Okay. So that was all about the coronary vessels. I hope you enjoyed it. Read it again and what I told you in the previous video also. जब आप सुन लेते हो उसे बंद करो, then try to think what you have listened. Okay, इसको सोचो. Or you write it somewhere and or you think about it without seeing it again. Then see ki when we listen for the first time, what are the various things that we missed. So read, think, and then revise it after some time. Obviously, these are the basic pillars of remembering any topic. Okay, so that's all from my side. Signing off, Dr. Ankit Khandelwal. I hope you enjoyed. All the best. Thank you.